Good evening, everyone. I can see that some participants have joined already. Just wait for a few minutes and then we'll start today's session. Let them
Good evening,
participate.
ma'am.
Yeah, good evening, Sonu. Let's wait for 5 minutes. Let's see if there are some other participants who are joined. Then we will start today's session.
तेरे चिक्की मारती नहीं हम खरीदी है ना जल्दी करना चावल तो भी नहीं है तेरी चावल नहीं बिकती है वो कहना मैं कितना कुछ नहीं देखा तो कहना मैं कितना कुछ नहीं देखा ऐसा नहीं समझ Mm.
Hello, everyone. Good evening once again. Let's start today's class. Today's live session on the topic of ASD. ASD full form is Autism Spectrum Disorder. And myself, Tanima Bhattacharjee, I'm an APTTI SEN Mentor. I'm going to take the live session for today. So, as we know, ASD, the full form is Autism Spectrum Disorder. What basically it is? It is a heterogeneous group of neurobehavioral syndrome. It manifests as difference in development in three main areas of an individual. That is verbal and non-verbal communication, social interaction, and imagination, which can be seen in repetitive and restrictive leisure and play activities. This is referred to as the trait of impairments. Autism may occur alone or may be accompanied with other sensory processing difficulties, intellectual disabilities, hyperactivity, motor difficulties, seizure disorder, or maybe may not be with learning disabilities. But regardless of the other accompanying condition, it is autism that require attention. Autism is known as spectrum disorder. As the name, from the name full form itself, we can understand that a spectrum disorder, because symptoms can range from a mild learning to social disability to more complex needs with multiple difficulties and often very unusual behavior. Autism results in qualitative impairments. What this means is that a person with autism skills are present. Skills are already present into the individual but do not develop age appropriately. Therefore, different skills develop at different space in different people with autism. Another characteristic and perhaps the most confusing features of autism is uneven skill development. Let's see the example. If a child were at the biological age of 4 years, his overall development will be as a 4 years child. But in autism, however, a 4 year child may have speech development like a 2 years kid, gross motor skill development like maybe a 8 years kid, or as a 6 years kid, maybe self help skill. So a person is able to basic arithmetic but not able to speak, or may know the alphabet, number, and nursery rhymes, but may not be able to speak his or her name or needs or desires. Because of all these characteristics, no two people on the autistic spectrum disorder look or behave in the similar way. They have certain common interest in the social communication and sensory issues that affect their behavior in a predictable ways. Their language skills may range from those who do not speak to those who display complex, grammatically correct speech. Some individuals may show only slight delay in language and a greater difficulty in making friends. That means the person, maybe the speech is not impaired, but in the social skills they have more difficulties. Or in other person maybe have difficulty in speech development, but he can make friends easily and he can play very easily with his peer. Some may have no sensory difficulties, while others, there is too much sensory information in everyday manner. However, each person has his or her own strength and abilities and limitations as well. And like all individuals, each person with autism has a unique personality and combination of characteristics. So let's start with the introduction. Autism can be split into two words, that is auto plus ism. Auto means automatically, ism means self. So it is a neurodevelopmental disorder. And the word derived from the Greek word autis. Autis means self. Skills are not development as the age appropriate, as we already gone through with the example that there is a 4 years kids, maybe his language speak as a 2 years old, or the self-help skill maybe 3 years old, but others fine and gross motor skills maybe as a 8-year kid. So there is an uneven distribution of the skills also. And some other have sensory difficulties, maybe or may not be the same sensory difficulties faced by the other individuals. Autism, formerly called Autism Spectrum Disorder and Autism Spectrum Condition as well. And sometimes it's called as only autism spectrum. It is a neurodevelopmental disorder characterized by deficit in social communication and social interaction and repetitive or restrictive pattern of behaviors, interest or activities, which can include hyper and hyporeactivity to sensory input. Autism spectrum disorder is a lifelong neurodevelopmental disability, a behavioral defined syndrome that is recognized by the main manifestation of behavioral characteristic across multiple areas of functioning. Characteristics are observed to various degree in the social relationship, communicating competence, pattern and range of interest, and sensory responsiveness. These characteristics are generally evident during the early childhood and must adversely affect educational performance as well. The definition of autism spectrum disorder has been written sufficiently broad that encompasses children who exhibit a range of characteristics related to ASD. We will go into the details of the different subtype of autism, and we will understand it later on in this session. Children with intellectual disability and or significant behavioral disorder are not automatically excluded, since in many cases this condition coexists with autism spectrum disorder. So now let's see the history, the developmental history of autism spectrum disorder. Paul E. Boulez, a Swiss psychiatrist, first coined the term autism in 1911. He used it to describe a subset of schizophrenic patients who seemed to believe are self-absorbed and withdrawn. As time passes, our thinking and understanding of autism has evolved dramatically. An analysis of the description of behavior trait observed in severe early documented cases suggested that these are in fact cases of what we now recognize as autism. Earlier also autism present, but it was not documented as autism. In 1911, a psychiatrist named Paul E. Boulez, he first coined the term that is autism. One famous and well-documented example of autism would be a story of Victor, a wild boy of Auvergne, who was found naked in the French forest. Victor did not understand any language and would eat only herb burned and roasted potatoes, walnut and raw chestnut. Some even believed that he had been reared by the wolf. The French physician Dr. Jean Artret took Victor under his care and brought him into the Paris. Dr. Itrat spent several years trying to train Victor, with the skills, so that he can come back to the human society, and teaching him languages. He was not completely successful, as Victor only learned some of the French words, but never fully understood the language. However, there was an improvement. Definitely, there was improvement in Victor's fine motor skills and communication skills. He also developed a friendship with his caregivers. It is now known that Victor may have been autistic, and however he lived with was unable to understand him. Hence, although autism seems to be a new condition, a look at its history suggests that it may have always been existed. Then Lee Conner, another psychiatrist, and Dr. Hans Asperger's have played the most crucial role in introducing autism to the world. In 1943, Dr. Leo Conner, an Australian psychiatrist working in John Hopkins Hospital, published a paper that described 11 children who displayed a strong desire to being alone, had a resistance to change, or need a sameness. That's the first identified features of autism. What was there? The three main characteristics were strong desire to be alone, had a resistance to change, and need for sameness. He introduced the term early infantile autism to describe his observation. A year later, Pallavi, can you just mute television mute because it's creating disturbance. Then he introduced the term early infantile autism to describe his observation. So a year later, Dr. Hans Asperger's, also an Australian psychiatrist, described similar characteristic in a group of children who was treating. It was eventually accepted as a diagnosis in 1981 and coined as Asperger's syndrome. Dr. Lorna Wing, an English psychiatrist, was pioneered in child development disorder and advanced the perception of the autism towards the world.
Ma'am,
So
today is not presentation slides.
it's not presenting. Oh,
Ma'am, today you are not presenting the slides now.
okay. Thank you, Sonu, to remind me. Uh, let's
Uh,
see. Maybe there is some technical problem. Just give me a minute, okay?
Now it's seen, ma'am.
Now is visible, ma'am.
Ma'am, can you show the second slide?
Ma'am, where are you?
Yeah. Now I'm visible. Okay.
Yes, ma'am.
Uh, can you see the slides also?
Yes,
Yes,
ma'am.
we
Thank you
can.
so much.
Yeah. So let's quickly go on through the topic we already discussed. So today's topic is Autism Spectrum Disorder, ASD. So if we quickly go on through with the introduction part, that is, autism is developed from the Greek word, that is autis. Autis means self. And it is a lifelong neurodevelopmental disorder. And the skills are already present in the individual, all the basic skill required for life skill, communication skill, but it is not developed as age appropriate. And there is an uneven skill development. What is uneven skill development? As with the examples we had gone through, the 4-year kids who have already the skills is present in the child, but in not in the same level. Maybe for speech have a 2 or 3 years. I mean, he speaks in a language that a 2 or 3 years old kid speak. And for the motor and fine motor and gross motor skill development according to the age of a 8 years child, or maybe the self-help skill and the communication skills is maybe as a 3 years old kid. So he know the alphabet, numbers, nursery rhymes, but he can't tell his name. He can't communicate that what his needs. That is the uneven development of the skills. And the sensory difficulties, obviously, that we will discuss in the later slide. Then the history. I'm showing the slide. Already discussed. Anyone want me to go through with the again with the history? So, and the history already suggests that in the early age, autism was already there in that society, but the world was not aware about the condition. They just considered maybe lunatic, but with developmental studies and various research, there is a particular term that is autism. It's come towards the knowledge of the doctors, and with studies they have learned the characteristic features, and they have finally specific terms for all these condition, that is a autism spectrum disorder. Then come for the prevalence.
Ma'am, what
Prevalence,
do you mean by prevalence?
prevalence means the probability.
Like
Probability.
in accounts, like in
Sorry.
accounts is probability. In accountancy also there is a probability, na?
Yeah, probability, the chance of
Prob-
happening.
tram-
Yeah. So like it was a one kid in 44, one child in 44 kids identified with autism. But it was the data before the COVID. After the COVID, the situation is 59 according to one kid with like the prevalence rate is already in a higher stage. 10 kids in 59 was identified at autistic, and 2041 higher baseline according to 2000. Boys are more prone to affected with autism and this neurodevelopmental disorder. They are more 4 times more prone to affected with autism. Although autism can be diagnosed before the child reaches the age of 2, most kids are diagnosed only after the age of 4. And the prevalence of the occurrence of the characteristic is the 40% are non-verbal. 44% have average or above average intellectual ability, and 31% have the intellectual disability. Then the definition. According to the Diagnostic and Statistic Manual of Mental Disorder, the American Psychiatric Association, that healthcare provider used to diagnose mental disorder, people with ASD often have difficulty in communication and interaction with other people, restricted interest and repetitive behaviors, and some symptoms that affect their ability to function in school, work, and other areas of life. Autism is known as a spectrum disorder. The name itself suggests a spectrum. So why it's called a spectrum? That disorder because of their wide variation in the type and severity of the symptoms that people experience. A widely used definition for autism by DSM-4, which classified autism as a pervasive developmental disorder. Children and youth identify as having a pervasive developmental disorder is characterized by severe and pervasive impairment in several areas of development, that is reciprocal social interaction skills, communication skills, or the presence of stereotyped behavior, interest, and activities. These behavioral patterns are shown in the first few years of their life and are significantly typical for the children mental age or developmental level. Then the Autism Society of America define autism as it is a complex developmental disability that typically appear during the first 3 years of life. The result of neurological disorder that affect the functioning of the brain, Autism is also associated behavior has been estimated that occurrence is 1 to 5 of 1,000 individuals. Autism is 4 times more prevalent in boys than girls and also no relation with the racial, ethnic or social boundaries. Family income, lifestyle and educational level do not affect the chance of autism occurrence. So our next slide. Now we will go the type of pervasive developmental disorder under the term as autism. Autism come under pervasive developmental disorder. So let's see what is pervasive developmental disorder first. Pervasive developmental disorder is a condition that involves a group of channels mainly centered around delayed or difficulty in mainly social and communication skills. Symptoms may show before the age of 3 years and can include but are not limited to difficulty in using and understanding language, difficulty relating to people, objects, or event, and difficulty with adapting to change in the routine or familiar surroundings. So, what are the type of pervasive developmental disorder? First is childhood disintegrative disorder, Rett disorder, autistic disorder, Asperger's syndrome, and PDD-NOS, that is pervasive developmental disorder, not otherwise specified. We will go each by each subtype into the details and we will discuss in our next slides. Next is childhood disintegrative disorder. The other two name of CDD is known as the Heller syndrome and disintegrative psychosis. The condition was first reported and described by a Australian educator Thomas Heller in the year of 1908, and according to his name, the condition is also called as Heller syndrome. It is a rare condition characterized by the occurrence of developmental delays after a child of 2 or 3 years old. These developmental delays are found in language skills, social skills, gross motor, and fine motor skills. As we go through with the details, every time we will see that the three areas are mainly affected. What are the three areas? That is the social skills, the communication skills, and expressive language. These three areas has difficulties and they have a typical behavior that shows that they are resistant to change. They always like to be in a fixed environment. So all the conditions they have mostly the common symptoms. The disorder is sometimes grouped into other to better understand the condition like pervasive developmental disorder or autism spectrum disorder. However, most children with PDD or autism will not also experience childhood disintegrative disorder that affect many different areas of the childhood development, and that is main reason it can sometimes be found with these other conditions. Childhood disintegrative disorder is thought to affect 1 in 1 lakh boys. The typical ratio of boys and girls estimated at about 8 boys affected to 1 girl. I mean, again, the boys are more have more chance to get affected with CDD than the girls. Regression usually start 2 or 3 years old, but can continue up to the age of 10. There is no definite research that pinpoint the cause of childhood disintegrative disorder. There are hypotheses that point to the condition possibly stemming from neurobiology or how the brain and the nervous system are formed and function. The study of Johns Hopkins Medicine of children diagnosed with CCD revealed that they mostly have a abnormal encephalography. Seizures have also been associated with the childhood disintegrative disorder and can indicate the occurrence of abnormal neurobiology. I mean, there is a definitely problem in the brain functioning system. The main difference, so how it's different from the ASD? CDD and ASD is a different term, though they have a similar kind of symptoms. The problems they experience are almost similar, but still they are not the same thing. So, how they are different from each other? That let's discuss. The main difference between CDD and ASD seems to be that with CDD, the child follow normal development to skills compared to the neurotypical peers until they are the age of 2 years, and then there is a certain regression in the field of language, motor, and social skills. Whereas with the ESD, the child typically misses some developmental milestone or meet them later in the neurotypical peers. So autism, there is a definitely from the problem from the childhood itself. When the child had birth, with the developmental delays, miss some milestone, maybe there's skipping of some milestones. But for childhood disintegrative, sorry, CDD, the child, it's normal till the age is he continue his development till the age of 2 or 3. Then there is a sudden regression of the problem, sudden regression, and they face the problem in the motor skill, language development skill, and the social skills. So sometimes CDD is always misunderstanding with ASD. So DSM-4 had a clear guidelines. So how that can be different from ASD can be different from the CDD. That is for CDD, apparent normal development for at least the first 2 years after childbirth, as manifested by the presence of age-appropriate verbal and non-verbal communications, social relationship, play, and adaptive behavior. The second one is clinically significant loss of previously acquired skill. The child has already acquired the skill, but there is a sudden loss in the acquired skill. That is before the age of 10 years. In at least two of the following areas, they have experienced difficulties, that is, expressive and receptive language, social skills or adaptive behavior, bowel or bladder control, play or motor skills. The third one is abnormality of functioning in at least two of the following areas, that is, qualitative impairment in social interaction, that is, impairment in non-verbal behaviors, failure to develop PR relationship, lack of social or emotional reciprocity. Qualitative impairments in communication, that is, delayed or lack of spoken language, inability to initiate or sustain a conversation, stereotype and repetitive use of language, lack of varied make-believe play. Restrictive or repetitive and stereotype pattern of behavior, interest and activities, including motor stereotype and mannerism. And the fourth one is the disturbance is not better accounted for by another specific pervasive developmental disorder or by schizophrenia. Then we come to the another subtype, that is Rett's disorder. It is a rare neurological disorder. Rett syndrome is a rare progressive disorder of the nervous system leading to impaired cognitive and physical development. The disorder results from a non-inherited genetic mutation, with almost all cases having no family history. Rett syndrome is a rare genetic and neurological and developmental disorder that affects the way the brain develops, causing a progressive loss of motor skills and speech. And this disorder primarily affect the girls. When autism and CDD or mainly affect the boys, but for Rett syndrome, girls are more prone to affected. Rett syndrome occurred almost exclusively in girls, affecting approximately 1 in 10,000 to 15,000 female. The incidence rate in the male is unknown, partly due to the male with the genetic mutation rarely surviving after childbirth, and in the rare circumstance where males with Rett syndrome survive, deficit are more severe, as males do not have an additional X chromosome to compensate for the mutation. Children with Rett syndrome typically shows normal development until the age of 6 to 18 months, and later followed by regression of cognitive, language, and motor function. Then again, the three main domain: cognitive, language, and motor functioning. On average, the life expectancy of females with Rett syndrome ranges between 40 to 50 years, with the date often occurring unexpectedly due to the secondary cause of pneumonia. A rare genetic mutation affecting brain development in girls. Most cases of Rett syndrome are caused by non-herited mutations on the dominant X chromosome. Most babies with Rett syndrome seem to develop normally for the first 6 to 8 months, and then there is a loss which have they already previously achieved milestone, that is ability to crawl, walk, communicate, or use their hand. Over time, children with Rett syndrome have increasing problem with the use of muscles that control movement, coordination, and communication. Rett syndrome can also cause seizures and intellectual disability. That is the other accompanied complaint or conditions. Abnormal hand movement, such as repetitive rubbing or tapping or replacing object. Although there is no cure for Rett syndrome, potential treatments are being studied. Current treatment focus on improving that problem they experience, that is movement and communication, treating the seizures, and providing care and support for the children with adults with Rett syndrome and their families. Despite being caused by a genetic mutation, Rett syndrome are rarely inherited. For Rett syndrome, there should not be any family history. All of it, there was mutation in the gene, and after the childbirth, the parents get to know that there was some problem, and then diagnosed with Rett syndrome, and it's happened only mostly with the girls. Infants seem healthy during the 6 months, but over time, rapidly loss of coordination, speech, and use of hand. Symptoms may be stabilized with the later stage of life, but there is a no cure. But medications, psychotherapy, speech therapy, physiotherapy, and nutritional support help to manage the symptoms and prevent complications and improve the quality of life. Comorbid are very common in Rett syndrome, including GI problems, scoliosis, epilepsy, unusual breathing pattern, sleep disturbance, and low bone density, leading to the increased risk of fracture. So that's all about Rett syndrome. Then the another, this is we all know about the term, that is autism disorder. So now it's considered an autism spectrum disorder. So we are discussing the subtype of autism. In earlier, there is one autism disorder and other conditions also. As they have similar kind of symptoms, now they are grouped into a term, that is autism spectrum disorder, and it is an umbrella kind of where they cover all the symptoms and characteristic, and the treatment and the guidelines is more of a same. Maybe sometime the developmental delays, they have skipped some developmental milestone. Maybe they have in some cases boys are more prone to affected, in some cases girls are more prone to affected, but almost there is a similar functioning level difficulties and impairments are in the same domain, like cognitive, language, and social skills. So now discuss about autism disorder. It is also known as classic autism. Was said to be characterized by widespread normalities of social interaction and communication, severity restricted interest, and highly repetitive behavior. Autism is also known as autism spectrum disorder. It is a developmental disorder characterized by communication, social, and behavioral challenges. The condition is lifelong, and the symptoms can vary considerably from one person to the another person. Then, if we consider the etiology, this is genetic and environmental factors. Again, the etiology, there is no single gene responsible for autism, and the multiple genes are believed to contribute to developmental disorder. While there is evidence to suggest that the genetic play a significant role, but there is another factor, that is environmental factors may also have a very bad impact to develop autism and cause genetic mutation. Mainly the environmental factor also cause genetic mutation that indirectly lead to the autism. It is important for parents to understand that there is no way to predict with certainty whether the child will develop autism, and early intervention and therapy can greatly improve the outcomes of the child presence with the disorder, but it cannot be predicted. With some genetical mutation disorder like Down syndrome, and it can be predicted, but for autism, as it is a neurological developmental disorder, it cannot be predicted before the childbirth. But early intervention always help autism. The primary difference between a high functioning autism, that high functioning autism we will discuss later, that is Asperger's syndrome, and those who have a low functioning IQ, that's are called that classical autism or autism disorder. People with high functioning autism and Asperger's have IQ that are on the normal or even superior level. Usually, healthcare providers misdiagnose children at an early age with the classical autism rather than Asperger's syndrome. Symptoms involve challenges or difference in motor skills and both intellectual and social abilities. People with autism may learn, act, think, communicate, and interact differently than people who do not have autism spectrum disorder. I mean, with the behavioral pattern and how they express, people can generally say that the person who have autism are different from their same age PR. Maybe they cannot say exactly what's happening, what's wrong with the kid or the individual, but they can identify that there is a difference with the neurotypical behavior and a neuroatypical behavior kit. Autism referred to as a spectrum disorder because there is a no so much variation in the term of the type and the symptoms of the people experience and the severity of the symptoms. Some other conditions can be mistaken with autism, that is developmental delays, lead poisoning, or Down syndrome. And the symptoms are very similar across the board: slow motor development, problem with social interaction, and impaired thinking skill. So sometimes they can be misdiagnosed with autism, so there is need of detailed evaluation and specialized person who can differentiate that whether it is a developmental delays or it is going to lead in the autism, because autism cannot be diagnosed before the age of 3. But always, as early intervention is very helpful, whenever the parents or the teachers, they will be able to understand that there is some variation, maybe different from the typical peer, early intervention is always very helpful. Then there is a Asperger's syndrome. As Asperger's syndrome is a high functioning autism. The name for the Asperger's syndrome has officially changed. This is Asperger's syndrome. They officially changed, but many still use the term Asperger's syndrome when talking about their condition. The symptoms of Asperger's syndrome are now included in the condition of autism spectrum disorder. ASD is now the name used to wide range of autism-like disorder. So all the subtypes we are discussing now, it doesn't exist individually into the society or DSM. They are directly taken under the term of ASD, and ASD is an umbrella like who is gathered all the characteristic features, symptoms under one roof and termed as ASD. When you meet someone who has Asperger's syndrome, you might notice that two things right off: that they are just as smart as other peer, but they have more trouble with social skills. They also tend to have an obsessive focus on one topic or perform the same behavior again and again. There is a repetition of the behavior, and they are so much focused on the repetitive behavior. The condition what doctor call a high functioning type of ASD, it means the symptoms are less severe than other kind of autism spectrum disorder. The DSM also includes a new diagnosis that's called the social pragmatic communication disorder. which has some symptoms that overlap with Asperger's syndrome. Doctor use it to describe people who have trouble talking and writing but have normal intelligence. So in Asperger's syndrome, the IQ have no impact. They have normal IQ or high functioning IQ. The majority of the children and adults with Asperger's syndrome live well and more able to enjoy their life and do many things as their neurotypical people can do. Many people will have some level of difficulties with some daily tasks and interaction. So here one term we just known as it, this is neurotypical. What is exactly
Ma'am,
neurotypical?
what type of neurotypical persons are there?
I'm discussing what is neurotypical term define. And neurotypical people are those individuals who do not have any diagnosis of autism or any other intellectual or development difference. I mean, a regular person who have normal neurological brain functioning. A neurotypical person is an individual who thinks, perceives, and behaves in the way that are considered to be normal by the general population. Some characteristic that people associate with neurotypical development include reaching developmental milestone at similar to their other children, such as learning to speak, having social or organizational skills that are similar to the person's peers, being able to tolerate some sensory discomfortable, such as loud noise with much difficulty. The cause, again, the cause is unknown, like ASD. It's not fully understand, but there is a strong genetic basis, which means it does not turn the run. It's tend to run into the families, but again, the multiple environment factors are also involved. They play an important role in the developmental ASD as well as Asperger's syndrome. The brain abnormalities may be involved. We do not know that Asperger's syndrome is not the result of child upbringing or poor parenting. Asperger's syndrome is a neurobiological disorder, meaning it is just a part of the brain development that is impaired, and cause are not till yet fully understand, but still genetic and environmental factors have some impact to develop Asperger's syndrome. Then the another subtype, that is PDD-NOS, that is pervasive developmental disorder, not otherwise specified. PDD-NOS stand for pervasive developmental disorder on non-otherwise specified, and PDD-NOS was one of the several previously separated subtype of autism that are folded into a single diagnosis of autism spectrum disorder with the publication of DSM-5. After publication of DSM-5, all the subtype we are discussing that covered under one umbrella kind of term, that is Autism Spectrum Disorder. These subtypes are no more exist as a diagnostic basis. According to DSM-4, that PDD-NOS is a diagnosis that is used for mild or severe pervasive deficit in the developmental of reciprocal social interaction or verbal, non-verbal communication skills, and a stereotype behavior, interest, activities are present. But the criteria are not met for specific pervasive developmental disorder or for several other disorders. And PDD-NOS can be considered as a atypical autism because the criteria for autism disorder are not met. May they have a similar kind of features and characteristic, experience same kind of problem, but some typical symptoms that a person or individual have autism experience, it's not related to PDD-NOS. And for instance, because of late the onset are typical symptoms or threshold symptoms or all these. Even though PDD-NOS is considered milder than typical autism, this is not always true. While some characteristic may be milder, others may are more severe. And prior to 2013, there were 5 separate diagnoses that exist in the autism spectrum. One of them is called pervasive developmental disorder, that is PDD-NOS, and now it's also known as atypical autism, autistic tendencies or autistic trait in the people with the diagnosis. The 5 subtypes were folded into a single diagnostic of autism spectrum disorder, the Diagnostic and Statistic Manual of Mental Retardation, after publishing that DSM-5, that is Diagnostic and Statistic Manual of Mental Retardation. So this was the 5 types of PDD. We had already covered the 5 types, that is childhood disintegrative disorder, Rett's disorder, autistic disorder, Asperger's disorder, and PDD-NOS. So from the discussion, can we conclude that they have almost similar kind of problem, or the children those who have autism or other condition, they have similar kind of problem and they experience same type of problem in their life? The main 3 domain is cognitive skill development, language skill development, and social interaction. So
Ma'am,
now,
what about the motor skills?
that is come under cognitive skill development, motor skill development may be or may not be associated, because there is a sensory issues. So sensory issues indirectly related to the motor skill development and fine motor skill development problem.
Miss Tanima,
Yeah, sure.
I'm Dr. Ruchi. I'm a developmental pediatrician based out of Chennai.
Okay.
So, if you don't mind, lovely presentation actually. You've spoken very well about autism spectrum disorder, the various types of PDD. But I think there are a few things that I would like to add, if you don't mind.
Yeah, sure. Come.
Yeah.
Yeah.
So basically, for everyone to understand very simply, autism spectrum disorder is nothing but there is definitely a problem with the social communication domain. Okay. And there is restrictive repetitive movements. So what you mean by restrictive repetitive movements is something that number one, these children might have a fixated interest, or they might have a high focus on a particular thing. Like many of these children, if you see, they like playing with just a part of the toy rather than the entire toy. Like if you give them a car, they would love to spin the wheels of the car and just stare at it. So that is something that they have.
Typical behavioral patterns they show.
And they have, if you look at the other repetitive behavior that we're talking about, I'm just giving you small examples because I don't want to drag this. So something called hand flapping. So they'll just keep doing this with their hands. So that is one important part that is an important part in the DSM-5 criteria. So since 2013, we've only been using DSM-5 criteria. DSM-4 criteria and the term pervasive developmental disorders itself does not exist anymore.
Yeah.
So it's all autism spectrum disorder, where we have the severity. It's just the severity that we talk about, which is mild, moderate, and severe.
Sorry for the interruption, but today's session was discussing about the subtypes. We are not discussing about the autism spectrum disorder characteristic.
What I'm trying to say here is, that there are no subtypes anymore. As per DSM-5 criteria, there is only severity of autism spectrum disorder, and there are no subtypes anymore. And in fact, CDD and Rett, they have been taken out of autism spectrum disorder umbrella itself.
Sorry, interrupt. Thank you for your knowledge and information. That's very good. But for today's presentation, we are not talking about autism spectrum disorder. In the books itself, it's still the subtypes are there. So there is a confusion between the students about the subtypes, because they have all similar kinds of problems, or they have impairments and similar fields, all the domains are similar. So I was more focused on the discussing the subtypes, how they are different from one another. So itself, that's why I'm more focused on the individual subtypes. I'm not considering autism spectrum disorder as the mode of presentation.
I'm sorry, but the subtypes do not exist anymore. From 2013, the subtypes do not exist anymore.
But here some other teachers are there. They are regular teachers. They don't know about the medical terminology. Even maybe they don't know even the term what is DSM. So I was more focused on discussing the subtypes, because in the books itself, okay, special education books or psychological books, the terms are still exist. DSM-5 is only for diagnostic manual. It's not from information purpose. It's for diagnostic criteria. But the teachers, they don't need DSM. They just need the information. What is the subtypes? So I was most focused on discussing the subtypes and how it's different from one another. Hope I'm clear.
I think that the teachers should really not just know how to identify ASD and how to when to refer a child that's under
Yeah,
their care
true.
to
It's true.
us
But
as
what
soon as possible.
exactly the problem that teachers are facing, as I'm a special educator, okay, I'm not a doctor. So what exactly when we go through with the books in the special education or a psychological book, the terms itself still are there. Maybe it's abolished from the society or diagnostic criteria. It's no more use the subtypes. But for information purpose, we need to read all these information.
Yeah,
So
but
always
we as
there is a
doctors do not
confusion.
label any patient with these terms anymore
Yeah,
because it's obsolete.
because every
We
time
don't
I'm
label them.
repeating that all the symptoms are similar. They have difficulty in mostly in the three domains, but all the subtypes as term only one umbrella term, that is autism spectrum disorder.
Spectrum disorder. Yes.
But
Yes.
today's discussion was not related anything to autism spectrum disorder, as the subtypes is all still exist in the books of psychology and special education. So I was trying to clear the confusion students or teachers are facing. What the subtypes, how it's different from autism. Is autism is something different and autism spectrum something different, and the childhood developmental delayed it's something different. I was more focused to clear all the confusion. Hope,
Yeah. So right now, it's all of this is just under autism spectrum disorder. There is only a single terminology, and that is called autism spectrum
that is
disorder.
for diagnostic criteria. Ma'am, again, I'm telling that is for diagnostic criteria, for not for the special education and psychological information purpose. Okay, that's terms for subtypes still exist in the books of special education and psychology. And you are talking about DSM. DSM used only for diagnostic criteria. Again, more emphasis on the term that is diagnostic criteria. When you are going to diagnose, but teachers and have they are not certified to diagnose whether the person had autism or not. They just able to know that it's different from other neurotypical children. So maybe some problem. So they just advise parents. So go with
Exactly. That's what we have to focus on.
Yeah,
So how can they identify the child earlier,
That is
and
the separate
then can they
definition
refer to the?
there that will be taken care of in a completely different presentation.
Yes.
The mode was I was just clearing the confusion what the subtype is.
Okay.
So now come back to the presentation once again. That is early intervention strategies. So if we know that the child is different from the his or her peer, so parents are advised, or maybe they had observed that there is a different behavioral pattern from same age student or same age children. So they go to the pediatrician. Pediatrician advise them to go to psychologist, check the IQs, and there is a different type of intervention can be taken after that. So we were not talking how to diagnose, who are available to diagnose, but we have just quickly gone through with the intervention strategies. What can be done if the children or the person is diagnosed with having ASD? That is a behavioral therapy, that is ABA, applied behavioral analysis. We just considered focused on one behavioral pattern. Then according to behavioral pattern, we will treat. That the goal of autism treatment should be treat your child's unique area of symptoms and needs. This often require a combination of treatment approach that incorporates several different type of therapy. When it comes to early autism treatment option, there are a variety of therapies and approach. Some autism therapy focus on reducing problematic behaviors and building communication and social skills, while other deal with sensory integration problem, motor skills, emotional issues, and food sensitivity. So if we quickly go through the terms, that is applied behavioral therapy, then the early start Denver model, that is approach that work best for the 12 to 24 years month old, that follows by the practice ABA analysis. And there is always one-to-one session with the therapist and the parents. That includes singing and some play activity, joint movements. Then the most important domain as the language and speech problem they always face. So speech and language therapy is required. And then they have sensory issues, hypo or hypersensitivity to stimuli. So there is a physical therapy, occupational therapy, and sensory integration therapy. Some children with ASD experience difficulty while controlling physical action, that hand flapping, echolalia. For example, they may have an unusual gait or trouble with handwriting. Physical therapy can help them to overcome with this problem. And occupational therapy helps children autism to build everyday skills that are useful for skills home, such as feeding, grooming, dressing itself. And this sensory integration therapy, that is, they have sensory difficulties, so find out the difficulties to process of sensory information and integrated sensory stimuli. Therapy is often required in order to sense to be more functional. It is a one form of OT, occupational therapy, and sensory integration therapy falls under the practice of OT, which is provided by a qualified OT therapist. And SIT delivered intervention and strategies designed to the help children in autism who have hypo or hypersensory difficulties. The session always focus on individual unique needs, so the child may also learn to use assistive device to adapt the situation and the complex tasks. Like if a child is facing handwriting problem, so there is a speech to text app that can be help the child. So, and there's a nutritional therapy, the required nutritional therapy. Some children have autism struggle with digestive issues. Like in some specific subtypes, we already have gone through that they have severe GI problem. So their nutritional needs always should be taken care. On the top of that, some children may show aversion to specific flavor or texture, such as the soft pulp of the tomato or the lumpy texture of the oats. Such as while meeting their nutritional needs is vital, it can also be a tricky endeavor. If your child is a picky eater, nutritional therapy can help you ensure to follow a healthy diet. A nutritional specialist can always help for this purpose. And another important thing therapy is cognitive behavioral therapy. That CBT can help the children with ASD to understand how to influence a behavior. A therapist show the child how to recognize, reevaluate, and regulate emotions such as anxiety, then depression, and then the
Sadness.
treatments of medical condition. So with autism, there is some common specific problems they always face, like anxiety, ADHD, depression, sleep problem, GI problem, then hyperactivity, maybe attention deficit hyperactivity, or may not be attention deficit. Simple hyperactivity can be there, or simple attention problem should be there. So this all condition can be taken care of. They need medication sometimes, and symptom specific treatment with medication or therapy.
Ma'am,
Then
can I ask something from you?
just a minute, let me finish the presentation, then we will discuss. Additional support. That support can be given by the parents or the teacher. Early intervention is always helpful for this autism spectrum disorder, and maybe they require more than one treatment. They need OT, they need speech therapy, and they have if they have other medication support they need. So parents always should try different therapies that can be help better. Follow through a treatment and home also. In case a therapist will guide you through the activities that the parents have to do with the child, and they be play-based activities. So what the scope of this treatment? That it's the interaction. I mean, there is a more interaction with the child. So with interaction, they will learn more, they will acquire more skills, and they empower. There is a good bonding with the child and the parents also, and they need a consistent schedule. Be a mindful to child comfort level. The parents should develop a consistent schedule. Whenever possible, stick to the routine and incorporate therapy session to let your child know when the schedule may change. And recognize the child's strength. Always, as we discussed, that skills is already present. Maybe or may not be developed yet, but sooner or later it will develop. So, first identify the probability of developing the strength, recognize the strength, and feed the student or support the students or the children based on their strength. There is a chronic management throughout the different development periods is always required. Maybe in the initial stage the child have different issues with speech, maybe have a speech problem. With speech therapy, the problem is abolished, but maybe have a hyperactivity problem or attention deficit problem. So there is a chronic management, continuous management support is necessary to maximize functional independence, quality of life, and by minimizing the course of ADHD future, facilitating the development and learning, promoting socialization, reducing maladaptive behaviors, and educating and supporting families also. For many individual, core symptoms of ASD may be see improvement with intervention over time. However, deficit typical remain throughout the lifespan, although development and expressions also may vary. So, autism just different for others, not less. We have high functioning autism, we have low functioning autism. They express themselves, they learn themselves differently, but they are not less others. And this is the ribbon that present to express the autism. So it is called Autism Awareness Ribbon. And thank you. That is the end of today's presentation.
Now, ma'am, I have a confusion. Nowadays, I am suffers a lot of lack of sleeping. So, what can I do? Can you please help me?
You can go and check with the medicinal practice. Okay.
Okay.
Yeah. So quickly we can go through with one or two questions because it's already at 7:10. The session was for one
Ma'am,
hour.
I was send you a mail on queries of previous webinar
We
also.
had a FAQ session. We will have a FAQ session, and then I will clear all your doubts.
Okay, thank you, ma'am.
So any questions? We can take few questions.
Good evening, Vidya here. I joined this session a little late because of the office. I got stuck in the office meeting. Can we have a recording of this?
No, we don't have a recording, but later it will be uploaded into YouTube. So you can talk to the official person. They will inform you when it will be uploaded into the YouTube. Then
YouTube.
we can go through that.
Okay, sure. And if you want to get more information, if I want to have a look into this PPT, how do I? Or you are going to share it by email to individual?
No, I have my email over here. You can directly, you have my email ID and it's there. You have my email ID. It's my official email ID. Can you see? It's
Just take a note. Yes.
Tanima. But the T will be in a small. Okay. You can come up any queries into through the mail, and I will get back to you through mails. Okay. So let's bind up for today. It was a nice session.
Not attend a complete session, so I wanted to have more information about this. Is there one more session to be conducted on this on any other day?
Maybe later it will be conducted. You will get the mail regarding the information. Okay?
Sure.
Yeah.
Thank you, ma'am. Bye.
If you
Good
have
night.
any queries, you can mail me directly.
Sure. Thanks.
Yeah. Thank you.
Ma'am, I was also send you a mail now.
Okay. Yeah. You can.
You answer these questions. Query.
That is the end for today's session. Good night,
Bye,
everyone.
ma'am. Good
Take care.
night.
Yeah.